You know, one of the things that I struggle and continue to struggle with over time is the relationship between a sociopathic parent and malingering. You know, I don't talk a lot about fictitious disorder, Munchausen syndrome, or malingering. Does that sound right? I don't know. Does that sound right? On this channel. And one of the reasons why is because it's not a psychiatric diagnosis. It's more of a legal terminology that really describes criminalistic behavior. Just think about it. You know, you go into your doctor's office and you either create symptoms or you exaggerate them, you lie about them, you keep the doctors going around in circles. You keep them confused about what symptom you have or what symptom you no longer have. And you do all of that with the intention of deceiving and manipulating for some ultimate goal. So in today's video, I'm going to highlight malingering and how it's associated with a sociopath. And we might as well go ahead for the sake of this video and throw in a narcissist. And this is going to be something that I'm talking about when it comes to parents. Okay, so it's going to be parents. And I think I'm going to also add in family as well, because it can be relevant for that population as well. But before we jump in, let me briefly introduce myself in case you are new. My name is Tamara. I'm internationally and board certified in trauma therapy. I'm licensed in mental health. I specialize in treating children, teens, and families, as well as adults who are dealing with trauma. Let's jump in. So when you're dealing with a parent who's a sociopath or a parent that has antisocial personality disorder, it can be a little bit difficult to believe them. You know, believability and authenticity is something you're never going to find in a parent with sociopathic or antisocial traits. And I'm not just talking about a parent who doesn't want to be bothered with other people when I say antisocial. I'm talking about an individual who meets this specific criteria right here on this screen. And when you have parents like this, it's more than embarrassing, I think, to have to deal with the fallout of their behaviors in society. I once had a young lady who saw me for psychotherapy about 4 years ago, and unfortunately her mother and her father were malingerers. And they would go to every doctor's office they could think to get an appointment with and, you know, really lie and manipulate and exaggerate and give conflicting symptoms. And then when the doctor would prescribe a medication or prescribe a certain kind of treatment, they would completely disregard what that doctor said. And over time, I realized that something very evil and sneaky was going on, and that was malingering. These kind of parents know how to go to a doctor and sometimes doctor shop, right? They go to this provider and that provider and that provider in hopes that they get something in return. And if a doctor seems to be either too educated or too on to them, or the doctor prescribes something that's most likely going to work, they drop out, they leave, they don't return, or in some interesting way, the situation changes. They're no longer in pain. They're no longer having headaches. They're no longer experiencing depression. They're no longer anxious. Oh, wow, they just learned some new coping skills. They're reading this really good book that's helping them learn how to cope better. Or they're seeing this coach who just, you know, immediately got rid of all their problems, you know? They're getting a divorce and all of a sudden they're cured. These are things that you're likely to hear amongst a parent or family member who's a malingerer. One of the reasons why is because this kind of parent family member is most likely seeking some kind of gain. That gain could be not losing time with an employer, right? Giving doctors excuses and doctor's notes from a provider who's truly providing them, but there's no medical condition. There's no reason for them to see the doctor in the first place, but they need the notices to work in their behalf because they just simply don't want to go to work. So they get a doctor's excuse and they give it to that employer. You might also see malingering in family members or parents who have been incarcerated, right? They feel that the prison system is going to give them a little bit more sympathy because they have this disorder, whatever that may be. And so prisoners, in research, it has been shown that prisoners tend to rely on malingering and even fictitious disorder, and I'm going to differentiate those in a minute. so that they can get some kind of sympathy. This is how they behave. This is how they think, you know. The other thing that you may see is in child custody cases or divorce cases. You may also see an individual, a parent, a family member use malingering as a way to get favor with the judge or to elude an attorney. And, I hate to say this because I have attorneys and judges in my family, so I don't want to cast a bad light on all of them. But I will say that, there are some attorneys that will encourage a client to use malingering to exaggerate something or portray themselves a certain way so that they can get off of death row, so that they can get out of being held accountable for a murder, a crime of some sort that they were involved in. And so unfortunately, malingering is something that some attorneys really support. Now, let me differentiate between fictitious disorder, malingering, and Munchausen syndrome. So here's what the differences are. Malingering is more of a legal term that you're going to see in forensic settings. And forensic settings would be something like in child custody cases, in cases where there's a potential a guilty conviction because of a murder. You may also see this in cases where the individual cries mental illness to get out of a crime, right? So that is malingering. It's more of a legal kind of a thing. It's not a medical condition at all. Now, fictitious disorder is just a little bit different. It is really an exaggeration of a physical and psychological ailment that does exist, but it is done in a way to also gain something, which would be attention or favoritism or disability income or win a case of some kind. There is a problem there, but it may not be as bad as they are exaggerating it to, if that makes sense. Munchausen syndrome is the same way. The only difference here is that they are making somebody else sick. If we're talking about Munchausen syndrome by proxy, somebody that they're caring for, sometimes a parent of a child, a parent of a mother. So a parent of a grandchild, a parent of a child, right? Something like that. You may even see your mother or your father care for your grandparent, and they make that grandparent sick so that they can get the sympathy, so that they can get the attention that they so very much desire. Now, Munchausen syndrome is, I'm going to seek sympathy and emotional support, psychological support by going to the hospital repeatedly and intentionally making myself sick. So I'm going to punch myself in the head until I bruise. I'm going to slip my wrist, my ankle, my thighs, and go to the hospital and cry, I'm so sick, I need help. And that's because, quote unquote, I like to be cared for. Munchausen syndrome by proxy is just as evil and manipulative, but it's the person not making themselves suffer, it's making somebody else suffer. One of my closest friends, she's a judge in the state of Illinois. And she had a case one time where, there was a 12-year-old girl. She was kept in her bedroom. She had an autism spectrum disorder. She was nonverbal, very much in an infantile state to have been 12 years old. But the scary part of this situation is that the adopted mother took this child under her wing and said, you know what, I'm going to be your mother. But she wasn't the mother that this poor child needed. She would actually feed this child different things that would make her sick and vomit, that would cause congestion. She would also rough handle the girl, which left bruises. And what mom did, because she had what we would say Munchausen syndrome by proxy, she would go to a children's hospital in the area and say, my daughter's hurting herself, she's punching herself, she's running into walls, I don't know what to do, help me. And, this poor child was diagnosed with cancer, diagnosed with a suicidal ideation with an intent to kill herself. She was diagnosed with depression, anxiety, bipolar disorder, all of it. And at one point, multiple personality disorder or dissociative identity disorder, which is the modern term, was diagnosed to make sense out of this child's bruises and psychiatric illnesses. The reality is that she was actually being neglected and abused, and she was suffering from post-traumatic stress disorder. And so this particular mother served a lot of time in jail. As a matter of fact, she's there now. She was convicted of a crime. She is there for literally 35 years. She's never going to get out. I will just say that this particular mother, adopted mother, was not okay. All three of these conditions right here can lead to some kind of legal challenge. And one of the reasons why is because the individual is a sociopath, a narcissist, or has some other personality disorder like histrionic personality disorder that drives the behavior. Now, I talk about histrionic personality disorder right up here in this video if you want to go check that out. Really what it is in a very brief and to the point explanation here is it is an individual who really lives and exists emotionally and psychologically off of drama. They know what to say and do to get the attention. They're loud, they're boisterous, sometimes flamboyant. They love attention, they desire and they crave attention, right? So anything they do in public, you're gonna see it, right? An example of this might be, let's say this histrionic family member or parent gets into an argument with somebody in a grocery store. They're not the person who's gonna say a few words, get upset, and go talk to the manager. They're gonna start throwing things at the person, knocking things off the shelf. Security is gonna need to be called. The police may need to be called. Shoes may go flying. Clothes are all over the place. Hair is all over the place. That is histrionic, okay? So these individuals take it from 0 to 200, never 0 to 10, right? Or 0 to 20, it's 0 to 200 in a matter of seconds. And so these particular individuals may get sucked in to Munchausen syndrome by proxy, fictitious disorder, and malingering. So let's talk about what you're likely to see in this kind of a parent and a family member. The first thing that you're likely to see with an individual, a parent, a family member who is like this is narcissistic and sociopathic personality traits. A narcissist really wants to be important in a lot of different ways. They crave the attention that powerful people get, right? They live off of and they are stimulated by other people's views and what's the word, opinions of them. And so they need to feel wanted and desired and important and perfect, if you will. And so these particular individuals may engage in malingering in order to get that attention, in order to elude the police, or in order to get out of something that they actually created for themselves. An example of this may be a speeding ticket, right? So let's say this particular individual is speeding on the highway. Let's say the highway, the highest is 75 miles per hour. They're doing about 90 miles per hour. And the only way that, they feel that they're going to get out of this traffic ticket that they may be getting pretty soon here is they're going to say to the officer, "I'm so sorry, officer. I have a brain tumor. I was on my way to the clinic the other day. I got some really bad news and I'm just a mess today. I haven't been myself since. I don't know what to do. I don't know what to think. I just know my life is over. I don't have any hope for myself." And they're going to continue going on and on and on. And it's not because they need the officer's attention. They want to get out of that speeding ticket and they want to be able to feel that they can do what they want to do. Okay, so there's some really serious narcissistic tendencies in these individuals, most of them. Now, could antisocial personality disorder or sociopaths be a part of this equation as well? Oh yeah, 100%. Now, a sociopath may say something like, "Officer, let me just explain something to you. My cousin's a police officer as well, and I know you guys get paid for giving out parking tickets. So I won't go there, but I just got a diagnosis. I was talking to my doctor while I was speeding, and I guess my doctor gave me some bad news, and I guess I put the pedal to the metal and I didn't realize it. I mean, can you forgive me?" That's a sociopath. They are using malingering in a way to kind of get what they want, but their sociopathic cold disregard for other people's lives doesn't come into the equation, right? It doesn't matter. They don't care about other people's lives. There's a cold, callous disregard, and all they want is to get off. And so they're going to use malingering. The next thing is you're most likely to see this parent or family member really exaggerate their feelings and behaviors. Again, like that histrionic personality I just demonstrated for you earlier, or defined for you. You're going to see that as well. Don't be surprised if the malingerer in your family really goes from 0 to 200, and it looks like it's an intentional buildup, right? They're not really emotionally invested. Their emotions seem like they are on a stage, and so what they're trying to do is draw attention and pity. They're not really hurting, so you're likely to see some histrionic traits or some really intense emotions in this parent and family member. The next thing is fear mongering and paranoia. You know, people who malinger, or malingerers, I guess I should say, also struggle with being honest and authentic, because again, a lot of these parents and family members with this particular thing tend to be narcissists and sociopaths. So you're likely to have a fear monger, someone who uses fear as an instrument. We may even go so far as to call it instrumental fear, right? They use fear as an instrument to harm other people or to manipulate the situation. And you're also going to see some paranoia, right? They may be very hypervigilant and feel like they need to question everybody's motive, but that's because they do exactly what they don't want done to them. Next thing is you're going to see a parent family member seek out attention, and then when they do get that attention, they may either start to backstep and say that they're not as sick, or they may seem to completely revamp themselves, right? They may no longer look sick anymore. They may not come across as really stressed and overwhelmed. They may really start showing that what they said about themselves as being wrong really isn't true, because they're so much better now that it's almost hard to believe that they were sick. So, you know, you're probably going to see a malingerer in your family member just really backstep, and it's confusing to you, I'm sure, because you're probably thinking, how did you get better that quick? You know? The next thing is a malingerer most likely will have an attorney present. Again, a lot of attorneys who are not really working for the good of society will encourage malingering, will encourage that individual to reach out to a therapist, get an appointment, stay in therapy for a few months, and then boohoo and cry, I need disability benefits, or, you know, I can't be in jail because I have post-traumatic stress disorder. Sometimes it's a legal trick, and unfortunately, some judges fall for it. That's the sad part. And we need to change that for sure. And lastly, you may find that these particular individuals within your family, or this kind of a parent, if you have one, is always going to appear as if they are acting on a stage. Lights, camera, action, okay? And that's what it's going to feel like. And even though that individual may be shocking to you and how they behave, or they may be saying things that just astounds you or floors you, always tune into yourself. Tune into your intuition. What are you thinking? What are you feeling? What's your internal state telling you? And these particular parents and family members will give themselves away every single time, because they're not as good of actors as they would, you know, like to be, or as they would profess themselves to be. So always look for that. Is this person acting on a stage? And if so, why? And how do I feel intuitively about what they're presenting to me right now? That's a good place to start. This is tough, guys, and especially if you have a parent like this, let me know in the comment section below if this is a parent, a family member. What have you experienced at the hands of somebody like this? Thank you so much for being with me in today's video. Go ahead and give this video a thumbs up if it was helpful, and hit that subscribe and bell button so you can stick around with us and get more videos. I will see you in the next video. Bye-bye.